Anita's better half, Dr. Devesh. Dr. Devesh Kumawat is similarly an excellent student, and he has appeared for all of these examinations. And he will be taking us through the FRCOphth examination.
Good morning, everyone. Thank you, sir, for the kind introduction. So I'll be sharing my experience on how I went ahead with the FRCOphth examination, and when should you start preparing about this examination and how to excel. So you can visit this website. You can visit this website by the Royal College of Ophthalmologists, London, and majority of what I'll be talking about is already there on this website, and you can get all the details regarding the examination patterns, the examination schedules, and the resources that that are being mentioned by the college itself that you need to look at while preparing for these exams. So this exam constitutes 4 sub-examinations, and if you clear them, then you get the prestigious award of Fellow of Royal College of Ophthalmologists, London. And following that, you need to pay an admission fee, and then you become a member of the college, and then only you can use the post-nominal FRCOphth. And this examination is important. Unlike the other examination, this is the examination which is the exit exam for the ophthalmology trainees in United Kingdom. So this is a examination that every ophthalmology trainee has to give. It is like our postgraduate professional examination, and therefore this examination is a little different from the other FRCS and FICU examinations. Now, part 1 is a written examination that assesses you on the basic and clinical sciences. This is almost similar to the part 1 examination of the ICO as well as FRCS. And then you appear for the refraction certificate examination, and following that you appear for the part 2 written and part 2 oral examination. Recently there has been some change in the way you can approach these examinations, that you can also appear for part 2 written examination now after part 1 examination, and then clear the refraction certificate and then appear for the final examination. Now there is no minimum ophthalmic training that is set here. So unlike the other examination, you can appear for the part 1 for the refraction examination even in your first year of your post graduation or your DNB course. But for the part 2 written examination, you should have at least 4 years of minimum of training in ophthalmology. Now, unlike the ICO and the FRCS examinations, there are no exemptions in FRCOphth. Since it is an exit exam, you cannot have exemptions in this examination system. Now, when to start, you should decide early. Again, I would also agree with my preceding speakers that residency would be a good time to start preparing for these examinations, because it will provide you a balance of the academic, clinical as well as personal life. And how to excel, the mantras remain the same for any exam, that you should know your syllabus, you should prepare well in advance, and you should plan at length and have a good clinical exposure. Now, coming to part 1 fellowship examination, it is an online examination. It is proctored, and it's a theoretical paper which assesses you on the basic and clinical sciences relevant to ophthalmology, which is similar to the ICO and the FRCS examination. But in addition to that, you have patient investigations are also being asked in this examination. So when to appear, there is no minimum training that is required. You can appear in your first year also, but since you need to know about the patient investigations and clinical sciences, it would be better if you appear in the final year or just after your residency. Now, the syllabus and the resources, you can visit the website for the syllabus and the resources. Important here, I have already mentioned that the patient investigations are, you should be thorough with your patient investigations. Therefore, it's better to give the examination in the final year or later. Now, coming to the refraction certificate, it's a practical exam in which you have 10 OSCE stations, and these OSCE stations will assess your practical skills on how do you perform retinoscopy. So you'll have simulators on which you'll have to perform retinoscopy, and you'll have patients as well on which you'll have to perform non-cycloplegic retinoscopy, and then subjective refraction, including refinement of cylinder and refinement of sphere, followed by binocular balancing as well as lens neutralization and photometry. So again, there is no minimum training requirement. You can appear in the first year as well, but you need to have an extensive practice before you appear for this exam. Otherwise, you will definitely not pass it. So again, the third year of residency, because you need to pass the first exam for appearing for the refraction certificate. So ideally, you should appear for this exam in your third year or maybe just after the residency. Now the resources, this important book which is on refraction and retinoscopy by Park, it is an excellent book and it is also recommended by the college. You can go through this book, but only reading will not help. You'll have to practice, 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 because you'll be marked on certain other parameters also, such as how is your hand hygiene during the examination, how good was your rapport with the exam with the patient, and how well did you communicate with the patient, and how did you manage your time. So time management, even if you overshoot your time by few seconds and you're not given your answer, you'll be marked 0 out of the maximum marks. Coming to the Part 2 fellowship written examination, it's again an online proctored examination, and it's a theoretical examination. Unlike the first paper, which assessed you only on the basic and the clinical sciences, here the entire curriculum will be, you need to be thorough with the entire curriculum. So when should you appear? You should have cleared the Part 1 examination, and minimum 4 years of training is required for appearing for this examination. And so I think a fellowship or a senior residency would be a good time to give this examination. Now the syllabus more or so will be similar to your post-graduation, but in addition to that, you will be asked about the health promotion, disease prevention, and continuing professional and personal development domains as well. Now Part 2 fellowship oral examination, it is slightly similar to the FRCS Part 2 examination, oral examination. It has the structured viva and the OSCE stations. Now again, you need to have 4 years of training to appear for this examination, and you should ideally, then the best time would be fellowship or senior residency to appear for this. Now in the structured viva, other than the patient management and patient investigation, you will also be assessed on how good you are in these domains, such as the attitude, ethics and responsibilities, audit, research, evidence-based practice, health promotion, disease prevention. Now these domains are included because the Royal College relies heavily on what you should provide is a quality and safe patient care. And other than the clinical knowledge, you should also be aware of these domains. Now in the OSCE, you have a combination of patient examination as well as some video based examination, in which you will be shown some videos and the examiners will examine you. And in the neuro-ophthalmology station, however, you have all three patients are real patients. There are no videos in it. And unlike your FRCS examination, you may be even asked about the general neurological examination of the patients in those stations. So, for example, I was asked about examining the patient, performing a general neurological examination of a hemiparesis patient. So I started with the cranial nerves. I thought I'll stop till the cranial nerves, which are involving the eye or the adnexal area. But then after that, they asked me to do the motor examination as a sensory examination also. But luckily, the bell saved me. And then you have the communication skill station, in which there will be one patient who'll be a simulator. He or she will be a trained actor, and then you'll have to counsel those patients. Mostly you will be given a situation in which something would have went wrong, and maybe in the surgery, and then you will have to counsel the patient. And believe me, they are very trained, and they'll get on your nerves if you are not prepared. Now, what are the tips for clearing the Part 2 oral and theoretical examination? You prepare your content list, what all you need to study. 3 months is more than enough time to prepare for this examination. Go to the clinical textbooks. Kansky and Oxford Handbook are enough for the clinical part. But for the non-clinical parts, as in the audit and ethics and the communication skills, you need to refer to the Oxford Manual of Training in Ophthalmology. It's a wonderful book. It will cover all those aspects. Then you should be thorough with the FRCOphth guidelines and the GMC good practice guidelines, because direct MCQs and direct OSCE questions will come from these guidelines as well. Now you should again be thorough with your ophthalmic investigations. Now there is not much resource which is available. Unlike with FRCS, you have multiple books which are available. For the MCQ examination in FRCOphth, you have a single book by Dr. Taryn Ting and David Steele. You can refer to that. And for Viva and OSCE, you have a book by Timothy Fung and Winfried that you can refer to. Now, most importantly, because you'll be assessed on how your rapport and communication with patient is, you should practice, you should improve your patient interaction also. Now, the pass criteria, as Dr. Devendra has already told, they are pass marks set in advance and they are not easy to understand. and the recent pass rates, they can vary anywhere between 35 to 80%. Now, this is worrisome that in Delhi, the refraction examination had just started a couple of years back, and the pass percentage was as low as 39% for the refraction examination. Now, validity, once you have cleared one part, that remains valid for 7 years. So you can appear for the next examination within that period, and you have certain 4 to 6 attempts also that you can give. Now, it's a long roadway. If you think that you'll finish these examinations in a couple of years, that may be a mistake, because I started giving them in 2018 and I finished giving the last exam in 2022 because of reasons that first, there are multiple steps, prolonged interval between the examinations, limited centers, and even if there are centers in India, you'll not get the diets every time. And if you see the exam schedule that is for 2024, there is no center in India which is going to conduct any of these examinations in 2024 now. So you'll have to wait for the next year for the examination center to come, and then you'll apply, and whether or not you get the diet is again a question. Now, the fees of FRCOphth is exuberant. It is more than the FICO FRCS examinations. So in 2022, when I'd given my final examination, it costed me 2 lakh rupees. And in 23, the price increased by 200 sterling pound, and in 24 again by 200 sterling pound. So now it will cost you 2.5 lakh rupees for just the final examination. Now, there is an annual subscription fee also. Once you clear the examination, there is an annual subscription that you have to pay to retain the membership. That is around 28,000 rupees currently. Now, the mantras for clearing any examination remain almost the same, but important here is that you should practice clinical interaction, because that is very different in this examination from all other examinations. An ideal best time would be just after the residency, or maybe in the final year of the residency you can start and then finish your rest of the examination during your fellowship or senior residency. And as my preceding speaker also mentioned, that keep learning and educating yourself, because there is no wrong time to give these examinations. Even if you are in your middle age, then also you can give. If you have you're in your clinical practice, then also if you're thinking about giving them, you can give, because successful people never stop learning. Thank you.
Thanks, Devesh. I think that really covered that topic, and it's definitely going to be of interest to anybody who wishes to